In this video, we will be demonstrating how to mix and administer low-dose hCG. First, gather your supplies. You should have a 10 ml syringe, a mixing needle, alcohol swab, an insulin syringe for administration, along with your powdered medication, and a clear diluent fluid for mixing. First, you will sanitize your hands. You can use warm soapy water or hand sanitizer. Next, we will open up the 10 ml syringe. You will open up the mixing needle and attach needle to end of syringe. Go ahead and place that to the side. Next, you will grab the powdered medication along with the clear fluid used for mixing. You will pop the tops off of the medication vials, and you will scrub the hub or clean the tops vigorously with an alcohol swab. Next, using the 10 ml syringe, you will draw up 5 ml of air into the syringe. First, remove the protective sheath from the mixing needle and drop 5 ml of air. You're going to inject this air into the vial of clear fluid. Once air is injected, you will swiftly, in one motion, invert the vial and draw back 10 ml of the clear fluid. Since it is now pressurized with air, it may take a while to fill up the syringe. Now that we have 10 ml drawn up, you want to make sure that you get the clear fluid vial out of sight, just out of the way, that we are just focusing on mixing the medication from this point on. Now you're going to inject the 10 ml of fluid into the powdered medication vial. To inject with the needle and to press the plunger down to make sure all the fluid is now mixed in the vial. Once the fluid is fully injected into the vial with the needle still attached, gently swirl to mix. Once mixed, carefully and swiftly remove the mixing needle and syringe and place into a sharps container. Now that our low-dose hCG is mixed, we're going to prepare for administering this medication. You want to make sure that you have a 30 or 50 unit insulin syringe. We're going to open up the insulin syringe. In this example, we have a 50 unit insulin syringe. And for demonstration purposes, we will be planning to prepare to administer 4 units of low-dose hCG. Pulling the plunger back, we're going to draw back 4 units of air. Next, remove the safety cap from the insulin syringe, and you will be injecting the 4 units of air into the medication vial. Once the plunger has been depressed in one smooth motion, you're going to invert the vial with the needle still inserted and carefully draw back 4 units of low-dose hCG. When verifying that you have drawn 4 units, look at the very top black line of the bevel to ensure that it lines up with 4 units. Now that we have our 4 units, you'll carefully pop the vial off the top of the insulin syringe, and now we will prepare for subcutaneous administration. Now we will prepare for subcutaneous administration of the low-dose hCG. You want to make sure you are finding a site on your lower abdomen, avoiding a 1-inch radius of the belly button, and you'll want to rotate sites for each injection. You'll prep the site by cleaning vigorously with an alcohol swab and allowing it to dry. You will pinch an inch or a fold of the area you are about to inject, grab the low-dose hCG insulin syringe, and you're going to administer at a 90-degree angle swiftly. Depress the plunger, fully administering the full dose of the medication, and quickly and swiftly remove the needle. Place the needle in a sharps container.